تعملوا ميوت بس. طيب تعملوا ميوت بس. هلو، سامعيني؟
سامعينك دكتور.
اوكي. هلا يمكن المره الماضيه حكينا عن مقدمه للكانسر، بس هلا راح نحكي يعني نعيد المحاضره بتاعت الكانسر. هلا طبعا treatment of cancer has evolved since the discovery of cancer. وقلنا يعني the earliest reports about cancer was maybe by the pharaohs or like ancient Egyptians. صار في تقدم كبير خصوصا بالفترة الأخيرة. Discovery of like immunity, development of أشياء اسمها monoclonal antibodies. Also they discovered إنه cancer cells depend solely on certain pathways, or they have active certain pathways or certain active pathways that would be possibly targeted by chemotherapy or special type of drugs. أنا حاسس إنه في إيكو. هلو.
دكتور سامعينك.
المشكلة إنه في صدى، يعني أنا بسمع صدى صوتي. طيب.
يمكن الكمبيوتر كمان المايك مفتوح مثلا.
هو مفتوح كان. خلص الأمور تمام الحمد لله. هذا أنا طفيته. هلأ شايفين؟
لا ما في سلايدات بس سامعينك.
اوكي، اذا زي ما قلنا بالفتره الاخيره صار في ديسكفريز كثيره في مجال السرطان، واكتشفوا انه السرطانات ممكن تكون تعتمد على pathways معينه in its proliferation, protection against cell death. يعني بالعاده التيومر مثلا انه when you treat it with chemo اللي هي العلاج الكيماوي المفروض يموته unless انه it has the ability to resist cell death. So they found انه في some pathways in fact يعني مسارات معينه في تكاثر الخلايا they are active and they lead to resistance of cancer cells للdeath.
يا دكتور سوري على المقاطعة بس السلايدات مو مبينة.
اوكي. اوكي هسه اوكي هاي ظهرت سلايد صح؟
دكتور
كنت بدي اعمل ستوب وستارت ريكوردينج بس مش مشكله. فزي ما قلنا انه في ديسكفريز كثير صارت ذات سيرف ذا ديسكفريز ان كانسر او حتى العلاج. واحد منهم شيء اسمه المونوكلونال انتي بوديز. Detection or discovery of monoclonal antibodies, which happened like in 1970s, 74, I think, أدى إلى اكتشاف واستخدام وإنتاج أجسام مضادة ممكن استخدامها بالتشخيص، في العلاج، في يعني هذول الميجر things. والتشخيص مثلا كمان they used monoclonal antibodies for research. This in fact revolutionized أو أحدث ثورة في الريسيرش in fact. زي ما قلنا يعني هاي المحاضرة هي principles، فأنا يعني I'm talking about some principles بالعلاج الكيماوي. now في نقطة مهمة لازم تعرفوها، إنه مهما كان السرطان يعني the earlier you detect it the better the outcomes for a patient. طبعا في أشياء يعني إنه لا حول ولا قوة إلا بالله death is imminent فيها. يعني ممكن قلنا المرة الماضية سرطان البروستات والبانكرياس هذول they are very fatal. سرطان اللوكيميا الأكيوت خصوصا this is very fatal unless you treat it. وif you treat it you end up with cure. يعني إنه cure معناها إنه علاج أو شفاء تام من المرض. هلا في عندنا استخدامات للكيماوية. دائما قلنا العلاج الأنجح لعلاج السرطان هو الاستئصال الجراحي السيرجري. وأي علاجات بتكون قبلي أو بعدي it has a term. العلاجات كيموثيرابي أو راديشن أو whatever يعني biological therapies أو شيء that are used before surgery they are called neoadjuvant therapy. والعلاجات التي تستخدم بعد العلاج الجراحي هي اسمها adjuvant therapies. وبالعاده احنا ما بنستخدم يعني one modality. يعني the old approach to treat any cancer انك تستخدم علاج واحد، ولكن الان صار نستخدم multi modalities hormonal biological chemotherapy. وطبعا كفارماكولوجيست في قسم السرطان او كلينيكال فارماسيست في قسم السرطان مهم كثير احنا نعرف what is العلاجات هاي، اعراضها الجانبيه، how to prevent it، التدخلات الدوائيه، اي thing related للفارماكوثيرابي او العلاج الدوائي بادويه السرطان. الكلينيكال فارماسيست بيكون عضو مهم كثير في الفريق المسؤول عن علاجات السرطانات. وطبعا this comes يعني by understanding anything related للدrugs سواء mechanism of action, activation by cytochrome P450 system, biodisposition, الأعراض الجانبية and how to approach them. So all of those knowledge about all of those is very important. هلا بالعاده في many ways to divide cancer chemotherapy. يعني this is like one approach to divide. في عندنا اشياء اسمها alkylating agents. على الاغلب الالكيليتنج agents يقسموا الى نوعين. في شيء اسمه classical و non classical. فالكلاسيكال هي العلاج التقليدي، العلاجات التقليديه. اوكي. والكلاسيكال الكيليشن هو عباره عن the use of a carbon backbone, okay, to attach to certain nucleophiles in the nucleus in the cancer cell. Okay, هاي اسمه العلاج الالكيليتنج classical alkylating agents. الالكيل جروب زي ما انتم بتعرفوا it's a carbon backbone. So classicals in fact they don't use carbon backbone or they don't lead to cross linking. يعني انه المبدا بالكلاسيكال alkylation انه تعمل cross linking that two nucleophile groups موجودات في الخليه، سواء دي ان اي، بروتينز، ليبيدز، انزيمز، بروتينز، وات ايفر. اذا في عندنا classical alkylating agents و non classical alkylating agents. هلا also we have anti metabolites. في عندنا many metabolites موجودات في الجسم, but the major three that are focused on هم DNA nitrogen bases skeletons اللي هم purines and pyrimidines. You know purines في عندنا الادينين والجوانين, والبيور pyrimidines بالدي ان اي بيكونوا سيتوسين وثايميدين, وبالار ان اي بدل التي بيكون في عندنا يو اللي هو اليوراسيل. And this is in RNA. And we have a major third metabolite that is antagonized, which is folic acid. So mainly anti-metabolites, anti-purines, anti-pyrimidines, and anti-folates. هذول هم ال compounds. Now within the natural products category, في عندنا many other drugs, but in some references they put or they have a natural products category. In fact, within natural products category, you can find anti-tumor antibiotics, tumor antibiotics. So those are obviously, from the name, they are antibiotics and they have anti-tumor effects. And that's why they stopped using them as antibiotics or antibiotics and then started to use them as anti-cancer agents. مثال عليهم هم راح نشوف أمثلة كثير عليهم, مثلا مايتومايسين سي, داكتينومايسين, bleomycin, and they perform non-reversible interaction in DNA اللي هو intercalation and other mechanisms of action like activation of free radicals and damage of components موجودة في الخلايا. في عندنا also group اسمها topoisomerase 1 inhibitors و topoisomerase 2 inhibitors. So inhibitors and inhibitors. مثال على topoisomerase 2 inhibitors, قلنا انه topoisomerase 2 اسمه بالبكتيريا DNA gyrase, وقلنا DNA gyrase inhibitors هذول group antimicrobial agents اسمهم fluoroquinolones. But here we are talking about topoisomerase in human, so not in bacteria. So topoisomerase 1 inhibitors في عندنا group اسمها camptothecins, epipedophylotoxins, while topoisomerase 2 inhibitors في عندنا camptothecins وانثراسايكلينز. هلا راح نشوف يعني اسماء. Also في عندنا سرطانات. اذا يعني those are subcategories الموجوده في الناتشورال برودكتس اللي هو الانتي تيومر انتيبايوتكس, topoisomerase 1 inhibitors, topoisomerase 2 inhibitors. في مايكروتيوبيول في عندنا مايكروتيوبيول targeting drugs كمان, يا اما stabilizing للمايكروتيوبيولز او dissociating للمايكروتيوبيولز. فالستابلايزنج اسمهم تاكسينز, وفي عندنا الديسوسييتنج اسمهم زنك الكالويدز. اوكي, هلا زي ما قلنا في عندنا سرطانات تعتمد على الهرمونات في البروليفريشن تاعها, زي سرطان البروستيت وسرطان البريست. So in both of those في عندنا hormonal antagonists that we could use to treat cancer. وقلنا طبعا امثله كثيره عليها لما حكينا gonadal hormones and antagonists, gonadotropin releasing hormone agonists, or anti-androgens or anti-estrogens, or in particular في عندنا selective estrogen receptor modulators. حكينا مثال على السيرم هاي اللي هو selective estrogen receptor modulator, ودواء اسمه التاموكسيفين, ويستخدم لعلاج السرطان البريست او سرطان الثدي, and also في مرضى بيكون في عندهم high risk to develop breast cancer اللي هم مثلا الفيميلز ممكن يستخدموا breast cancer risk assessment calculator, ممكن اورجيكم اياها in the future او انه next lectures, او انه ممكن نشوفها بالoncology module. فالفيميل تحسب الريسك بتاعها بالبريست كانسر, and then according to that اذا كان high then you can use tamoxifen for prophylaxis او انه يقلل نسبه الاصابه بالسرطان الثدي. هلا the newest categories اللي هو targeted therapy او pathway targeted therapy, او يعني relatively new نحكي. في عندنا to target any molecule في الخليه, يعني مميز انه abnormal او انه very active في خلايا السرطان، يا اما you targeted وهو على سطح الخليه ف you could use monoclonal antibodies, so it is an extracellular receptor or component, or if it was an intracellular component you targeted by intracellular targeting molecules او بسموهم small molecule inhibitors. And في عندنا many examples about those agents. هلا the most recent breakthrough بال 2018 in fact two scientists they were rewarded a Nobel Prize for their discovery regarding something called immune checkpoint inhibitors. And the fact بقدرة السرطان to surveil for cancer cells أو immune surveillance and detection of cancer cells is a cause of cancer. يعني المناعة العادية يمكن previously حكينا عنها، في عندنا two types of cells ممكن يحددوا خلايا السرطان يقتلوهم، هم ال NK cells أو الناتشورال كيلر cells، وفي عندنا CD8 أو cytotoxic T lymphocytes. effect بقدرة الخلايا هذولا through long pathways يعني إنه أو immune pathways to detect the cancer is something that necessitates the use of immune checkpoint inhibitors. Okay, وراح نحكي عنهم بالتفاصيل. This is like a bigger cartoon or flow chart that shows you agents اللي حكينا عنهم. إذا في عندنا to synthesize DNA or RNA في عندنا purines and pyrimidines. ممكن كمان الفوليت يدخل فيهم السينثيسيس تاعتهم. So في عندنا many examples على البيورين anti metabolites. في عندنا 6 mercaptopurine 6 thioguanine. وفي عندنا البيراميدينز في عندنا many examples عليهم. في عندنا فلورويوراسيلز، وفي عندنا جيمستابين، سايترابين، فلودرابين، 2CDA or كلادريبين، وفي عندنا نيفل في ديسكفرز كثير يعني كلوفرابين، نيفلاريبين. Those are like newly discovered. They are active in like targeting مثلا certain variants بالكانسر سواء leukemias or lymphomas. في عندنا انزيم اسمه رايبونوكليوتايد ريدكتيز. اوكي and في دواء اسمه هيدروكسيوريا مشهور انه it's used for management of some types of cancers like مثلا it was one of the historical options for management of CML, but بعد ما اكتشفوا انه في abnormalities معينه بالسي ام ال اللي قلنا عنها المره الماضيه it's Philadelphia chromosome. It's termed as Philadelphia chromosome positive CML. They use targeted therapy for treatment of CML, which is Philadelphia chromosome product targeting therapy اللي هو بسموهم also BCR ABL tyrosine kinase inhibitors. واحد منهم اسمه imatinib. Now في عندنا percent بسيطة صغيرة 5% من مرضى CML ما بيكون معهم فيلادلفيا. يسموهم non-classical or atypical CML, so they use chemotherapy. بيستخدموا لهم الكيماوي مش targeted therapy اللي هو الإيماتينب. Also يعني historically زي ما قلنا CML was treated with interferon, hydroxyurea, زراعة نخاع العظم. But nowadays with the discovery of the target and a targeted therapy لإله صار يستخدموا الإيماتينب as a first. هلا قلنا انه when DNA or RNA is used as a template بصير في عندنا شيء اسمه unwinding لل DNA and it would be used as a template and this creates superconing or شد كثير على ال DNA بال leading phases or parts الموجوده في مقدمه ال DNA. So to relieve that stress حكينا عنها هاي fluoroquinolones inhibit an enzyme اسمه DNA gyrase or bacteria have a DNA gyrase 2 or topoisomerase 2 to break a double strands of DNA, unwind or relax DNA and then it would ligate it or بالحموم كمان مرة. In humans the same thing happens during replication. في عندنا topoisomerase 1 breaks a single strand and relaxes DNA or unwinds DNA and then ligates it back again. في عندنا topoisomerase 2 it breaks two double strands or the double strands and then relaxes DNA and then ligates it. So if a drug can inhibit this relaxation of DNA, it could lead ultimately to DNA break and then this leads to destruction of DNA in the cell and it triggers cell death. وزي ما قلنا في عندنا جروبس اسمهم Epipodal toxins. هذول they are topoisomerase 1 inhibitors. وفي عندنا camptothecins which are topoisomerase 2 inhibitors like في دواء اسمه irinotecan or topotecan. Irinotecan is like a drug of choice for management of stage 4 colon cancer. So يعني it's very popular وكمان في استخدامات كثيرة بالبريست cancer. وفي عندنا الابيبيدال توكسينز هذول بيستخدموا لللوكيميا. also topoisomerase 2 inhibitor هم جروب اسمهم anthracyclines. في دواء always as accessory لهم اسمه anthracene dione derivative اسمه metoxantrone. So all of those are anthracyclines are topoisomerase 2 inhibitors plus they have some other mechanisms of action. زي ما قلنا الالكيليشن اللي هو use of carbon backbone to يعني مثلا lead to destruction of DNA or يعني covalently bind to DNA, inhibits its unwinding or causes damage to DNA. Those are classical alkylating agents. While if you use something other than carbon backbone or simply not cross-link the DNA or simply methylate it, this leads to DNA damage. So methylation of DNA is done through a group of drugs اللي هم temozolomide or في عنا procarbazine مثلا. It could use this mechanism of action. So it doesn't cross-link DNA, but simply it methylates DNA. So this is a non-classical alkylating agent. Another non-classical alkylating agent doesn't use, in fact, carbon as a backbone, but rather it uses platinum. So those are called platinum alkylating agents or non-classical. They are also grouped as non-classical alkylating agents. في عندنا أي دواء بتلاقي باسمه platinum زي cisplatin, carboplatin, oxaliplatin. So all of those are platinum compounds. So they use platinum as a core that mediates the alkylation, but not a carbon backbone. When DNA replication happens, you know, إنه الcopies, replicated copies of DNA بتكون بنص الخلية, and then في عنا centrosomes, they go to the poles of a cell and then extend microtubules, and then those microtubules will start pulling the DNA to the poles أو أقطاب الخلية. So المايكروتيوبولز مهمات كثير في انفصال الدي ان اي كوبيز بعد الانقسام الخلوي اللي هو الميتوسيس، اوكي، ويا اما تثبيت المايكروتيوبولز او تكسيرها. It plays a role in inhibition of mitosis او الانقسام الخلوي. ففي عندنا two agents, in fact they are used to inhibit the function of microtubules زي ما قلنا التاكسينز. Those are microtubule stabilizers, and vinca alkaloids, they are microtubule dissociators, okay, or they destroy microtubules. Now في عندنا أدوية ثانية زي الأبوثيلونز or estramestin. هذولا they were discovered and they damage something called microtubule associated proteins. So they collectively affect microtubule formation and the replication of DNA daughter copies. في عندنا سرطانات، مثلا في سرطان لوكيميا AML معين، في عندنا بيكون في الرست للخلايا بفيز قبل ما يوصلوا للمايلوسايتس. يعني شو معناها؟ خلايا السرطان خصوصا السرطان الحاد بصير في عندنا الرست للديفرنشيشن اوف سيلز، ما بيوصلوا للماتشور فورم. So this creates اول شيء هايبر بلاستيك او خلايا بتتكاثر بسرعه، and لانهم ما راح يتطوروا يوصلوا للالتيميت يعني انه functional type of cells، معناته ان we don't have immunity or immune system is compromised. مثال عليها ال AML بانواعه، ومثال in particular شيء اسمه acute promyelocytic leukemia. المyelocyte differentiation is associated at a step called the promyelocytes. So those are يعني before myelocytes أو الخلايا الميلوسايتس. So one agent or one option إنه to drive their differentiation using some drugs. ففي عندنا drug اسمه أترا اللي هو all trans retinoic acid or arsenic trioxide. هدول الاثنين they shift the differentiation of promyelocytes to fully mature myelocytes. Okay, so those are called in fact differentiating agents. طبعا واحد من الاعراض الجانبيه اللي بتصير مع هدول انه في عندنا lots of differentiation of cells, lots of functional leukocytes or white blood cells, so they start infiltration of certain types of organs زي CNS. طبعا بنسموه differentiation syndrome او يعني this is a side effect له. وزي ما قلنا في عندنا hormonal driven cancers زي prostate والbreast, so we use hormonal agents antagonists. قلنا في عندنا targets that we could target يا اما cell surface molecules or intracellular molecules راح نشوفهم in details بالchapter الثالث من الجروب هاي. وإنه immune checkpoint inhibitors, so all of those are or play a role in يعني cancer management خصوصا recently. هلا ادويه السرطان ما بتستخدم فقط لعلاج السرطان، في عندنا استخدامات كثيره لها. فمثلا يعني على سبيل المثال للحصر يعني anybody who knows cancer يعني مثلا knows انه rituximab is not only used in autoimmune diseases. في تداخلات يعني فيها. مثلا rituximab is one option for management of organ transplantation, but this is like what the book had an example. So rituximab monoclonal antibody راح تشوفوا انه map any drug ending with map monoclonal antibody, so it stands for monoclonal antibody, is used for autoimmune diseases, many autoimmune diseases. Rheumatoid arthritis we use مثلا methotrexate or cyclophosphamide. Cyclophosphamide is a chemotherapy alkylating agent type. Crohn's disease we use 6-mercaptopurine. 6-mercaptopurine is a purine analog. Organ transplantation we use methotrexate and azathioprine, which are folic acid antagonists. والسيكل سيل انيميا طبعا نستخدم له هيدروكسيوريا، بس طبعا hydroxyurea in that particular therapy is not used because its ability to inhibit ribonucleotide reductase, which is an enzyme involved in DNA synthesis. But rather hydroxyurea, it drives the formation of gamma globin, okay, which is like induces the expression of the gamma globin. So gamma globin would replace a sickle cell hemoglobinopathy or defective protein in that hemoglobinopathy. Psoriasis without P, يعني no, we don't pronounce it. So psoriasis اللي هي الصدفية is treated with many agents. One example is methotrexate. وفي عندنا في ال conditions اللي بصير فيها عندنا retinopathy زي diabetes مثلا with macular degeneration بصير في عندنا bleeding جوا العين. So we use anti VEGF, which is طبعا يعني through the etiology راح تشوفوا انه الريتينوباثيز خصوصا بالسكري بيصير في عندنا swelling بالريتنا and it detaches from a layer اسمها choroid, okay, and since choroid provides blood supply to the retina, so retina has low oxygen there, so the retina starts formation of new blood vessels which are leaky, and this leads to formation of blood clots بالعين. هاي طبعا يعني one of the mechanisms of diabetic retinopathy أو نزيف العين في السكري. Okay, so one approach is to use anti-VEGF therapy زي ما بنستخدم مثلا bevacizumab is injected directly into the eye to treat those conditions. هلا definitely we are talking about principles in cancer chemotherapy. You should know إنه a cell has cell cycle, so دورة الخلية. This cell cycle begins when الخلية تكون dormant أو يعني خاملة، أو إنها تطلع من replication قبل، يعني إنه السايكل cell cycle قبلي. فالخلية لما تكون dormant بتكون اسمها G0. So it starts the G1. G1 عبارة عن cell cycle component أو الفيز، مرحلة دورة الخلية التي تحضر لصناعة DNA. So cell cycle phase that prepares for DNA synthesis. والDNA synthesis phase بيسموه S phase. هلا في عندنا protein synthesis phase or phase cell cycle phase that prepares for replication اللي هو الميتوسيس بيسموه G2 phase. Okay, so sorry, G2 phase. هلا تقدر تحكوا انه السيل سايكل is a production line، يعني خط انتاج لانتاج خلايا، وبكل خط انتاج في عندنا regulators، يعني انه زي ماشينز بيحركوا، وبعد كل فيز في عندنا let's say QC اللي هو quality control، يعني للمرحله. فالدرايفرز او دافعات التكاثر هي عباره عن بسموها سايكلينز، والاشياء اللي بتعتمد على السايكلين سايكلين ديبندنت كاينيسز. في كل فيز مثلا في الجي 1 فيز في عندنا 2 سايكلينز، سوري I think انه في 2 cyclins but the drawing shows 2 اللي هو cyclin D و cyclin dependent kinase 4 and 6. When those are activated, this drives the development of the G1 phase and starting of the S phase. And in S phase we have cyclin A and cyclin dependent kinase 2. And in G2 phase, we have cyclin A and cyclin dependent kinase 1. And in the M phase, اللي هو mitosis phase, we have cyclin B and cyclin dependent kinase 1. So all of those, they are activated sequentially, and then they lead to advancement of the cell from one cell cycle to the next cell cycle. هلا also the cell is concerned about checking its performance, the quality control اللي قلنا عليها. ففي عندنا شغلات within the cell cycle, they are called cell cycle checkpoints. We have a checkpoint that makes sure انه all of the cells components مثلا they are activated. مثلا cyclin D, cyclin 4 and 6 during G0, G1 phase are activated. Or sorry يعني انه sorry انه replication or components for replication of the cell cycle are activated اللي هو P53, P21, MDM2. يعني with time you will see that those detect the integrity of the DNA. Also في عندنا components to detect the integrity of the replication. زي ATR or check 1, check 2, or components that check also for the functionality of the or the end product of the S phase and the separation of the DNA daughter copies مثلا topoisomerase 2 مثلا alpha P53 check 2 ATM. So all of those are components that are needed to check if the components of one phase of the cell cycle has progressed to the next phase properly. So like you can see, you know, this is like a cartoon that is extracted from an article in 2017, but the textbook doesn't show, you know, we have 4 cell cycles. In fact, it shows that we have 3 cell cycles. So as you can see, the cell cycle components مثلا اللي هو G1 cell cycle, it detects DNA damage. G2 cell cycle, as the textbook refers, it detects cell side defect or DNA replication. And the M phase cell cycle detects spindle assembly checkpoint, which is like spindle formation or mitotic spindles اللي حكينا عنهم. which detects اللي هو attachment of DNA daughter copies to the spindle or microtubule spindles. In general, like those are the cell cycle checkpoints. If you can see, like this is like also another figure that shows, you know, how some growth factors, like for example, here we have receptor tyrosine kinase that is driven by insulin or insulin-like growth factor, attachment to the insulin-like growth factor receptor, activates a certain pathway. Like in this, we have PA3 kinase activates AKT, activates mTOR, and then activates cyclin D and cyclin-dependent kinase 4 and 6. Now, those components help in the phosphorylation of retinoblastoma protein. Now, retinoblastoma in the unphosphorylated form بيكون attached and inhibits some component مهم في DNA replication. It's called elongation factor 2. So when retinoblastoma protein is phosphorylated, it will dissociate and it will be degraded. Like it will undergo proteasomal degradation. This makes elongation factor 2 available to be involved in DNA replication or elongation of DNA. So this will trigger, obviously, exit of the cells from G1 to S phase. Like this is like just an example. So all along the way, we have many drugs that have been developed to inhibit all of those like pathways. خصوصا إذا, if you know, like this is like the pathway that drives replication of breast cancer cells through either hormonal factors or certain other growth factors. So we have PI3 kinase inhibitors that could play a role in that. We have mTOR inhibitors, زي temsirolimus, everolimus. We have also recently have some agents like cyclin-dependent kinase 4 and 6 inhibitors, ribociclib, palbociclib, and also we have يعني مثلا other agents حكينا عنهم بالهرمونال ثيرابي انه الاروماتيز inhibitors inhibit the conversion of testosterone from the kidney, from the adrenal cortex to estrogen or estradiol, and aromatase inhibitors are the major components for management of breast cancer. الستات اللي بيعتمدوا على إنتاج الاستراديول from the adrenal cortex, not the ovaries. Okay, so those are the option for post-menopausal, يعني بعد انتهاء الدورة, يعني menopausal management of breast cancer, الأروماتيز inhibitors. Now, pre-menopausal إذا كانت الأوفريز شغالات, so we have to use like more aggressive approach, like the use of estrogen receptor modulators. زي estrogen selective estrogen receptor modulator اللي هو tamoxifen. في عندنا fulvestrant, we will see إنه it's a selective estrogen receptor downregulator or degrader. So all of those, زي ما شفنا, they are recent therapies for management of breast cancer, خصوصا like the ones on this side. PA3 kinase inhibitors, mTOR inhibitors, cyclin-dependent kinase 4 and 6 inhibitors. وقلنا عن cell cycle components. Now, this is like an important figure. It shows you that when a tumor replicates in its tumor of origin site, يعني مثلا breast cancer is replicating. Not all breast cancer cells are the same. We have a heterogeneous population of cells. In fact, in breast cancer. And heterogeneity leads to many consequences, in fact. One of the things اللي هو that is described here, according to the modifications that you apply to the tumor, خصوصا here chemotherapy or radiation therapy or surgical resection, you remove some of those variants and some other variants will remain, and those could have the ability to metastasize to different sites. That's why يعني مثلا كل سرطانات they don't metastasize to a certain site. They metastasize to different sites. And this is like, as the book describes, it depends on the modification by chemotherapy. هلا modification of a cancer doesn't only happen due to chemotherapy, but also the tumor has genetic instability. And this genetic instability, in fact, leads to promotion of cancer. أعطيكم مثال عليها. في بالCML in particular, it's a highly dynamic cancer, chronic myelogenous leukemia. بحيث إنه التغيرات الجينية اللي بتصير فيه are progressive، بحيث إنه في at certain phase بيصير في effect بيصير اسمه cytogenetic evolution in CML، بحيث الCML بتطور من phase بطيء اسمه chronic phase. So chronic phase اللي هو slowest growing CML، بعدين بيتسارع النمو الكانسر، بيصير شيء اسمه accelerated phase. بعدين التيومر بتحول من chronic ل acute phase، حتى بيسموه blastic phase أو sometimes بيسموه blastic crisis. So this is due to the genetic instability that is there in leukemia. In fact, genetic anomalies or instability is reported in many types of cancers. يعني مثلا colorectal cancer في عندنا شيء اسمه microsatellite instability or instability in its genetic material. It could be high or low, in fact. And this is like some component, diagnostic component to know microsatellite instability or genetic instability, how far it is in the tumor. By the way, microsatellite instability high, in fact, warrants or recommends the use of immune checkpoint inhibitors as a modality for therapy. Then we have, in fact, زي ما قلنا, lived through like many changes or discoveries in cancer therapy that have led to let's say knowledge about cancer or changing in the modalities of treatment of cancer. In fact, one approach or one modality or one discovery is the discovery of the presence of growth factors that would drive the proliferation of a cancer, or even abnormalities in intracellular signaling pathways that would lead to the development of cancer. Now, also, tumors or even our cancers or our own normal cells, they could modify the expression of genes. How is that done? By epigenetic processes. What's the meaning of epigenetic processes? It means that when a fragment of DNA is to be translated or replicated, like replication or transcription, or translation to be converted to mRNA, it is controlled by regions in the DNA called promoter regions. Now, promoter regions, they are also regions of DNA, but their availability for control of the expression of transcription and translation is determined by certain modifiers. So if you methylate promoter region of DNA, okay, this is called DNA methylation. This leads to increase in the hydrophobicity of the promoter region, and it will be repellent, it will be crumbled, or it will it will collapse. It will not be available for transcription agents or nuclear transcription agents. and this leads to suppression of transcription or translation. So also we know there are some histone proteins, and DNA is in fact wrapped around those histones, and this is a way to organize DNA. If histones residues are acetylated, it will increase their hydrophilicity, and then it would lead to relaxation of the components of DNA around the histone, and those would be available for expression. So those are like the earliest two epigenetic regulators of gene expression. So either DNA methyltransferase or DNA methylation, or histone deacetylase or histone acetylase enzymes, HAT or HDAC, which is histone acetyltransferase, or histone deacetylase, HDAC, HDAC it means. So those two regulators are modified by drug therapy. في عندنا DNA methyltransferase inhibitors, and في عندنا HDAC inhibitors that are known to be like therapies for certain types of cancers, like cutaneous lymphomas or melanomas. So, and they believe in epigenetic processes in the same way, like hypermethylation or hypoacetylation or whatever, like hypomethylation or hyperacetylation is a way to regulate two genetic components مهمات في driving of the cancer. دائما الكانسر في عندك طبعا this is one of the theories of cancer. You have either overexpression لشيء اسمه proto-oncogene, which converts it to oncogene, or suppression of the function of something called the tumor suppressor gene. Okay, so if you suppress or delete the tumor suppressor gene, you will not be able to suppress the tumor, so tumor will proliferate. So it's either overactivation of proto-oncogene or downregulation or deletion of tumor suppressor gene. Imagine that what you can do with the DNA methylation or histone deacetylation to those two genes, and how would they drive the tumor. Also, tumor vascularity or blood supply to the tumor is a major determinant to its like proliferation, drug delivery to that cancer مثلا. Also, we have some defects in DNA repair. يعني قلنا انه اذا متذكرين قلنا microsatellite instability high is a determinant of the use of immune checkpoint inhibitors, but another gene اسمه mismatch repair gene involved in the repair of DNA. If it was deficient, okay, versus proficient means functional, but if it was deficient, this is another indication to the use of immune checkpoint inhibitors. So like we recently we discovered a link between genetic anomalies and then the immune surveillance defects. Like this is like why they are indicated in those particular scenarios or situations. Which is like زي ما حكينا immune escape mechanisms. وزي ما قلنا the ability of the tumor to escape cancer cell death is a way to resist chemotherapies. We know إنه we have many organ of origin cancers. مثلا we have lung cancer, breast, prostate, colon, leukemias, lymphomas. في عندنا abnormal types of cancers مثلا. And those are different in the histology, but the histology is a major determinant of therapy. It is the major مثلا determinant of the approaches to treat any type of cancer. فمثلا lung cancer, it is prudent to know the histology to divide مثلا lung cancer into a small cell lung cancer or a non-small cell lung cancer. And within the non-small cell cancer, the predominant is adenocarcinoma, but we have squamous cell carcinoma. And the histological grading or like assessment of the tumor into those components is very prudent يعني for therapy. فمثلا إذا حكينا البريست knowledge about the type of يعني the tumor, like is it in situ or in situ or it is invasive. Histologic assessment of a tumor is very prudent in the determination of approaches for therapy. سواء البريست, lung, colon, prostate, all of them. هلا في عندنا molecular markers for some tumors that could help in the treatment or detection of relapse إنه يرجع التيومر. But till now we don't have a tumor marker مثلا for early detection of cancer. يعني discovery of such thing يعني is يعني something important, but in general for let's say early discovery of a cancer, it depends on how frequent it is and knowledge about early detection. يعني this is like the major focus that we have to have or apply in the population. يعني مثلا breast cancer is common. It could be happening in some families. So for that reason في عندنا early detection of breast cancer سواء باستخدام البريست سيلف اكزامينيشن على عمر ال 20 and up or بعد عمر مثلا ال 40 في recommendations to use something called mammogram for early detection. Now this is like the age groups for standard risk يعني somebody who doesn't have a high risk of breast cancer. بس زي ما قلنا if you have a family history or if you could use the breast cancer risk assessment tool, you could have an idea about like what breast cancer risk you have. So depending on that, you could apply اللي هو strategies breast self examination قبل ال 20 سنة. It could be like at 10 or 14 years of age. طبعا we know انه with different مثلا type of cells, they have the ability to travel to different sites, which is the metastatic site. So even حتى بالbreast cancer, we have different metastatic sites. بالprostate, like we know there are some like expected metastatic sites. Bilcolon also we know that there are some expected metastatic sites, but we have variable sites like the tumor could metastasize to. But still in therapy, when you have a metastatic site, especially for solid tumors, this makes the tumor hard to treat. So دائما في عندنا stages للtumor according to the proliferation. يعني most of the time في عندنا stage 1, 2, 3, and 4. Now stage 4 means metastatic, and it's the most difficult to treat, except for يعني we have some exceptions. Now, most recently, they discovered something called oncogene addiction, which is simply the dependence or addiction of a tumor on a certain growth factor or a single certain pathway that would support its proliferation. We know within certain tumors, like for example, there are some pathways that are activated. زي ما قلنا في CML, chronic myelogenous leukemia, في عندنا abnormal protein that drives their proliferation. This is reported in 95% of cases of CML, which is BCR-ABL. في عندنا in GIST, which is gastrointestinal stromal tumor, في عندنا abnormality protein أو pathway اسمه c-KIT. وبالbreast cancer, some variants, we detect overexpression of something called human epidermal growth factor receptor 2 أو HER2. And in lung cancer and colon, melanomas, we have abnormalities with epidermal growth factor receptor. So this is like within individual tumors. But the recent trend is now to find a common pathway in a certain group of cancers. and مش عارف يعني إنه I think I thought I have placed it قبل سنة تقريبا أو سنة سنتين إنه they released some news إنه في عنا علاج سرطان بيستخدم لعلاج كل أنواع السرطانات. Okay, it depends on the same principle, but it's like not true news. In some cancers, you could detect like some variants, like neurotrophic receptor kinase, anti-RK kinase, neurotrophic receptor kinase, and this component, if it is overexpressed or abnormal, okay, you could use a certain therapy. And this mutation is reported in 4 or 5 cancers. So like this is like the news. It could be used in multiple types of cancer treatment, but it is not there in all of those types of cancers. It could be overexpressed in some cancers, but not overexpressed in some cancers. So there is like an approach to try to find commonalities between cancers and try to find a common therapeutic modality. And this is like the approach of something called the basket trials. So this is like an NCI or a National Cancer Institute dictionary entry, which is a type of clinical trials that test how well a new drug or other substances works in patients who have different types of cancer that have the same mutation of or biomarker زي ما قلنا like anti-RK neurotrophin receptor kinase. So you can see that يعني oncogene addiction is a new definition, but it's like maybe exaggerated for some reason, but it might have a future if we find like some commonalities between cancers, like growth pathways. With the various discoveries, immune checkpoint inhibitors, with pathway targeted therapies, with the hormonal agents, cytotoxic agents are, يعني, let's say, indispensable or inexpendable. They are very important components that could be mixed or added or timed with other agents to improve response to of the tumor to treatment. But cytotoxic agents, as you know, like they have multiple types of or side effects, and the proper approach or treatment with proper approach or treatment, you can overcome those problems or difficulties and or side effects. One يمكن حكيناها قبل, I'm not sure يعني بخربط بين المحاضرات بعطيها. One thing يعني which is good is to know the risk of vomiting with cytotoxic chemotherapies, and accordingly use the anti-emetic patient to service, which could lead to many other consequences. So, like this is one approach to manage that. Also, we said, I think we mentioned that in a lecture. We give chemotherapy in cycles, and with each cycle, we wait till the body recovers or the bone marrow recovers, and then we give the next cycle. But sometimes the body responds aggressively to the tumor, and the time to recovery would be longer. But a longer time of recovery, let's say the tumor is growing, you give a chemotherapy, and then it drops the sequence, the number of cancer cells, but it goes up back. So if you wait longer time between periods for the body to recover from a chemotherapy, this means that tumor will proliferate in that time. So we give chemotherapy, and then the tumor cell count will go down, but the bone marrow recovery will be slower, so the tumor will have a chance to grow. For that reason, we could use agents like granulocyte colony stimulating factor to enhance the recovery of the immune system to make it faster to give cycles of chemotherapy and not to allow نحكي cancer cells to grow back in size. زي ما قلنا إنه blood supply to the tumor cells are limited خصوصا لما يكبر tumor, and then the tumor will secrete components that will stimulate the growth of blood vessels inside the tumor. This is called aneogenesis. And angiogenesis is an important driver, in fact, of or it mediates resistance, خصوصا or even resistant to angiogenesis is expected in or even resistance to angiogenesis agents is expected in many cancers like brain tumors. So angiogenesis, in fact, it will form leaky blood vessels, which will reduce the blood pressure to the core of the tumor. This would not enable optimal delivery of tumor anti-cancer agents to the tumor itself. So in use of anti-tumor, anti-angiogenic agents could improve the drug delivery and normalize the blood flow, and then ultimately improve drug delivery to the tumor site. In fact, many theories have arisen on angiogenesis and the use of anti-angiogenic agents. They should be used in a timely manner or timed with the administration of the cytotoxic chemotherapy to ensure optimal drug therapy or synergism. Let's say synergism is collaboration. Both cytotoxic drugs or pathway inhibitors would lead ultimately to tumor cell death, which would release the antigens of the tumor from the core of the tumor. And this leads to detection of those antigens by the immune checkpoints or the immune system, and stimulate the immune system to attack that tumor. Ultimately, زي ما قلنا في عنا in 2018, Hajima and Anderson, both of them, they received Nobel Prize for the discovery of the immune checkpoint inhibitors. طبعا the earliest publication, one important publication of Anderson, was in 2016 about the immune checkpoint inhibitors. And in summary, immune checkpoint inhibitors, the discovery of immune checkpoint inhibitors enhanced the response to chemotherapy or successful management of tumors. Resistance is a problem that we face with many types of tumors, and there are many mechanisms of resistance. For example, a problem with the delivery of the anti-tumor agents to the tumor itself, or that could happen either by genetically determined variations of the tumor, or the mutations that happen along the road during the treatment of cancer. For this is in general mechanisms of resistance to all drug therapies. But for targeted therapies, for example, we have some mutations that will inhibit the ability of the specific or targeted therapies to bind to that target. For example, في عندنا BCR-ABL tyrosine kinase اللي قلنا it is inhibited in the management of CML. There are some mutations that are reported that inhibit the interaction of the inhibitor with the BCR-ABL. One important mutation is T315I or A, which is replacement of threonine at position 315 with isoleucine or alanine. And this leads, in fact, to formation of bulky group in the site of binding of the drug and inhibits its interaction with its receptor. في عندنا many mutations that are reported للEGF are also and still those are being reported. The problem إنه when this happens, like maybe mutation happens to one cell, and then all of the other cells will die, but that one cell that has the mutation would survive and then replicate, and ultimately, by many years, it will be the predominant cell type in the tumor, which would not respond to the conventional therapies. So this is like how resistance happens. It happens to one cell. This is selected. The mutant is selected, and it will remain, but it will take some time to replicate and leads to relapse of the tumor, or إنه يرجع التيومر. We have also some mechanisms that are reported to immune checkpoint inhibitors, like development of alternate pathways or expression of markers or immune checkpoint inhibitors. So immune checkpoint inhibitors, which are programmed death receptor ligand 1 or CTLA4. Those are highly expressed by the tumor, and it will resist more the immune checkpoint inhibitor, which are antibodies that are targeting those two main components. Many approaches are being used to exploit the immune system to target the cancer. One of them is the CAR T cell therapy. What's the CAR T cell? So CAR stands for chimeric antigen receptor. Simply, we take a T cell, which is the T cell that is able to detect and activate an immune system or immune response. And we attach or we synthesize a receptor that is abnormal. So that receptor has the basic components, intracellular components that drives cell response, but instead of an outside component that is used to, let's say, mediate response to other T cells or stimulation by the immune system, this component would detect cancer cells. In one variant, it is a monoclonal antibody that detects a certain component, اللي هو CD19 مثلا, on cancer cells. CD19 is expressed in some types of cancers. So a T cell modified with a receptor that would activate a T cell but detects CD19 target on cancer cells would be created. Okay, it's called the chimeric antigen receptor. Chimera is like like it's a mythological creature with different components, like head of a falcon and wings, and the tail that is made of a snake, the body of a lion. So it is like chimera is a mix of species. Here we have a mix of receptor components. A receptor component that is used to detect CD19 and an intracellular component that leads to ultimate activation of a T cell. So we modify T cells, we expand them or replicate them, grow many copies of those mutant T cells, and then we put them back inside the host cell. In fact, this is like an approach that is used for management of lymphomas and leukemias. Like this is like a real therapy. They take a cell from the host or the cancer patient, modify one of its the cells of receptors, expand or replicate those cells and put them back to the body. So like this is like زي ما قلنا established therapy اللي هو الCAR T cells, CD19 CAR T cells. So this approach, in fact, it overcomes many types of resistance to cancer cells. Previously, we mentioned for a cell to replicate, in fact, there are some abnormal genes or proteins there. And also, زي ما قلنا, proteins, those proteins could undergo mutation. that would lead to resistance to other types of cells, types of cancer chemotherapy. خلينا نعطيكم مثال. يعني مثلا في عندنا جين اسمه BRCA1 or BRCA, sometimes they describe it. And BRCA detection, اللي هو BRCA 1 and 2, is a predictor of incidence of both breast, ovarian, and ovarian cancer, and maybe other types of cancers. Now, BRCA mutation, if you detect it, and it is a test that could be used in cancer cells or cancer patients, you have the option to use PARP inhibitors, like olaparib. This is an approach in breast زي ما حكينا, but also in ovarian cancer. BRAF mutations are also expected. فمثلا في BRAF mutation اللي هو 600 V600E. This leads to interruption of a major pathway. Later on, it's called the MAP kinase pathway. Now, MAP kinase begins when the epidermal growth factor binds to its receptor, which is epidermal growth factor receptor, and it drives a signaling pathway that starts with RAS, then RAF, which is like BRAF, we mentioned, then MEK and ERK, and ERK induces like replication and proliferation and survival of cancer cells. Now, usually, this pathway is sometimes overstimulated by such a mutation. So this blocks, in fact, any modalities that could be used before RAF molecule, any moiety that targets the receptor or the intracellular domain of the receptor is not functional in this situation. So we could use either BRAF inhibitors for that variable or mutant, اللي هو vemurafenib or dabrafenib, or you could use MEK inhibitor, which is tramitinib. In small cell lung cancer, non-small cell lung cancer, it's usually the trend to detect mutations in epidermal growth factor receptor. And if those are there, this means that components, like this is the opposite. If exon 19 and 21 mutations are available in non-small cell lung cancer, this would make some epidermal growth factor pathway targeting therapies highly effective. So those, if detected, we could use gefitinib, erlotinib, afatinib for management of non-small cell lung cancer. One mutation that is expected in EGFR, in non-small cell lung cancer, that leads to non-small cell lung cancer cells resistance is mutation called T790M, which is threonine replaced at position 790 with methionine. And this leads to resistance of all three agents, gefitinib, erlotinib, afatinib. So osimertinib could be used in that situation. And like HER2 expression or overexpression is detected in breasts and osteosarcomas. So this is like a test that could be used before selection of drug therapy. زي ما قلنا mutations in RAF or even RAS could be detected, and they determine if you could use EGFR targeting therapy in colon cancer or small cell lung cancer. Overexpression of estrogen receptor and progesterone receptor, they are very necessary to determine if breast cancer is hormone dependent and the use of hormonal agents. Okay, and في عندنا مثلا recently some recent gene arrays that could be used. We take samples of breast cancer, we send it for PCR, and if the gene profile expression detects high risk for relapse of tumor using hormonal therapy, this is necessary to use for certain patients. We certainly need to use chemotherapy. Now, then those are gene arrays that detects high risk of relapse of tumor. and determine if chemotherapy is necessary in breast cancer or not. So in general, breast cancer, you have to treat it only with surgery and hormonal therapy if it was hormone dependent. The use of chemotherapy is questionable, but with the use of these arrays, it determines if you could use chemotherapy or you don't have to use chemotherapy. Let's talk later about finish this chapter. في أي سؤال عندكم؟ اوكي، شكرا جزيلا وبنشوفكم المره الجايه ان شاء الله. السلام عليكم.